We will talk about depersonalization. Depersonalization means that when you have feeling that you distanced from your body and you're watching your body like a movie. You're watching your body from outside. You're talking, you're speaking, but you distanced from your body. So depersonalization is subjective feeling. It's not objective condition. It has objective results, of course. It affects person's daily life, but it's subjective sensation. Depersonalization affects around 2% of population. And main characteristics and main hallmarks of this condition is that person feels distanced from his body, feels physically distanced from his body, and it shows that he's observer for his life and observer from outside, like you watching movie which is called your life. And we have very classical example of description of depersonalization. It's from Jean-Paul Sartre. It's philosopher who intake hallucinogenic medications, and he describes it that he's distanced from his person, he's watching everything from outside, and everything happens in his life, but he's watching outside from outside and no emotions. This emotions is not his own, but he's only observer. So person at this case has sense that this life is not real and alienation. So person thinks that he is not real. He is watching himself out from outside and think that he is not real. For example, this woman is sitting at the meeting and she hears her voice, and she sees herself from outside, and it looks like that she is only outside observer of herself. That's the point. So she hears herself, she sees herself from outside like a movie. Another example is person is looking in the mirror and he recognizes his face. He knows that he is the person, but he has feeling of stranger. He has feeling that this person in the mirror is stranger for him. It's individual thinking. It's not objective. It's feeling that he feels that the person is stranger. Now let's say what is reason, what is underlying cause of depersonalization. In most cases, depersonalization is caused by trauma, anxiety, and depression. More than 60% of cases, it is caused by trauma, anxiety, or depression. So it's many cases it's post-traumatic, for example, for after a car accident or major trauma in your life. Also, anxiety is common associated condition, and depression also. Another cause is alcohol withdrawal and hallucinogens in 20% of cases. So minority of cases, it can be caused by epilepsy also, or temporal lobe tumors or migraines, but such cases are much rarer. So majority cases still on trauma, anxiety, depression, alcohol withdrawal, and hallucinogens, 80% of cases. Now let's say what is underlying mechanism and what we know. We don't know actually what is a real cause of depersonalization, but there is some associations. For example, low serotonin level is associated with depersonalization, but not all cases low serotonin causes depersonalization, because we know that depression is caused by low serotonin, but not all depression is accompanied by depersonalization. But some depressions can be accompanied by depersonalization. Also, another observation is that brain part which is called prefrontal cortex. It's frontal part of our brain which is responsible on self-awareness and memory. This part of the brain has decreased activity during depersonalization attacks or during depersonalization events. Also, amygdala, which is part also of brain, and amygdala is responsible on emotions, on fear, and on anxiety. Amygdala is hyperactivated. So prefrontal cortex, which is responsible on self-awareness, is decreased activity, and amygdala, which is responsible on fear and anxiety, its activity is increased. That is the mechanism which we know. Now, what about treatment and what treatment we have? First line treatment is cognitive behavioral therapy, which effectiveness is around 70%. 70% effectiveness is very high. And antidepressant, serotonin reuptake inhibitors, selective serotonin reuptake inhibitors are common also. They are independent. Effectiveness is not very high, it's around 50%, sometimes less, but in conjugation with cognitive behavioral therapy, effectivity is high. What is the idea of cognitive behavioral therapy? It looks like when your brain, if we get analogy, it looks like that we have computer, and computer has viruses, and viruses delaying computer working and disrupts computer working. We can imagine that these viruses are our thoughts about depersonalization, and these viruses are triggers of depersonalization events. For example, these triggers can be deadlines, for example, or stress events, or crowded places, or different types of events. We can identify what are triggers or what are viruses, and then we start cleaning our computer or cleaning our brain from such disruptive thoughts and disruptive triggers. And how we can deal it? We can deal it that we starting learning coping mechanism against these triggers. Coping mechanism can be exercise, can be walking, can be mindfulness, breathing, for example, deep breathing, which calms our brain and calms our mind because of parasympathetic nervous activity. Also, it can be dance or read or talking to loved ones. They are coping mechanisms. Which we can use against triggers. When trigger happens, you can do coping mechanism. That's the idea of cognitive behavioral therapy. Of course, cognitive behavioral therapy requires a skilled specialist, therapist, and at this case, everything is easier. But the idea is that you should find out triggers, and then you should learn how to cope these triggers. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.